Hello, good morning, everyone, and welcome to the Partnership at Drug Free New Hampshire's Facebook Live. My name is Julie Yerkes, and I am the Community Engagement Lead for the Partnership at Drug Free New Hampshire, and I want to thank you for joining us today for our Facebook Lives, where we explore emerging topics and current prevention strategies and initiatives around the state of New Hampshire. If you are watching live, please chat in and let us know where you're from and what you do, and we'd love to connect with you. So this week, the Partnership at Drug Free New Hampshire is celebrating National Prevention Week. National Prevention Week is a SAMHSA initiative. SAMHSA is the Substance Abuse and Mental Health Services Administration. And this week is a national public education platform that showcases the work of communities and organizations across the country that are dedicated to raising awareness about the importance of substance misuse prevention and positive mental health. And it recognizes that the important work of prevention happens every day. National Prevention Week celebrates these year-round initiatives and the possibilities prevention brings. So we found this year's theme so fitting for the partnership because honestly, that's what we do all year round is we celebrate our partners, we celebrate the work that they do every day, and we want to elevate their work. And we know that it is that, collective impact of our work that will have an effect on the issues that are present in our state. So today, and I think that, sorry, I was going to have Nikki put in the chat with the link to National Prevention Week, but I think she already did. So today, we want to welcome, I want to welcome my colleague, Martha Bradley, Senior Consultant at JSI Research and Training, because Martha works on a lot of initiatives, prevention initiatives around the state, particularly related to tobacco. And so I'm really excited to have Martha here with us today to share what some of these initiatives are. So welcome, Martha.
Thank you, Julie. I'm glad that you asked me to participate in this and to be able to share some of the work that we've done with our partners, especially the Tobacco Prevention and Cessation Program, TPCP. For the last really quarter of a century, we've been working with them since the master settlement funds started to be pushed out to all the states. And so we've worked with them really shoulder to shoulder, providing cessation services and treatment and then prevention efforts. And so today, I thought what I would do is just share some of the current things that we're working on around prevention and cessation.
That would be great. Yeah. So, I didn't realize that it's been 25 years or so, and I'm sure there's been a lot of changing initiatives and objectives because the tobacco landscape has changed so much in the past 25 years, right? New products coming through, new initiative, a new emphasis, I'm sure, on prevention at different times, new focus populations and so forth. So I'm excited to have that historical knowledge as well. So today, why is tobacco prevention work so important?
Yeah, well, I think today it's so important, just like it was 25 years ago. It is still the leading cause of disability, death, and disease in the U.S. For adults. And so that's what makes it so important. It's affecting so many people. And it's as important today as it was 25 years ago, because we know that when people use over the course of their lifetime, it's expensive. And it's expensive for our community, it's expensive for them, and it leads to, it's really the leading cause of preventable death. So that's why we want to address it. We have a lot of other public health issues that are happening, but This one is still very deserving of attention and funding. So I like the good, we'll cover the good news and the bad news, right? So the good news is all those investments that the Tobacco Prevention and Control Program have been making over the years has made a difference. So we know that we've seen the prevalence rate of smoking among adults go from 25% in 2000 to 14% in 2020. So that's really the good news. The not so good news is that there are still communities that are impacted disproportionately, that they carry the higher burden of smoking, death, disease, and disability. And so those populations, or those people, are those who have a lower income or have a lower education attainment, and those who are dealing with some sort of substance use issue or condition and a mental health condition. And I'm happy to talk about some of the things that we're doing for those groups of people in a little bit when we get to that section. So that's kind of where things stand for adults. But then we have the side, the not so good news when it comes to our youth. And you just look around, you talk to anybody who's working in a school, and vaping is a problem. And this is a problem that has been created by the companies that produce the vape devices, by people who do the marketing. It's really a public health epidemic. So on the one hand, we should feel really good that fewer youth are smoking. Fewer youth are smoking cigarettes, and there's been a drastic decrease with that. But on the other hand, we can't lose sight that the vaping rates are increasing. And so between, like, one of the more recent stats I pulled, between 2017 and 2019, nationally, more students are reporting using a vape device or electronic vapor product or ENDS. And that went from about 41% to about 50%. And the rates are probably even higher now. So you ask yourself, like, why is that so concerning? Because you hear, oh, vaping, isn't that safer than smoking? Like, isn't that like a way to quit smoking? Well, first of all, that's really a myth, especially for youth. We have a very well-known, respected researcher, Dr. Glantz. Recently, he crunched 7 years of data from the National Youth Tobacco Survey. In a recent article, he showed that switching from cigarettes to vaping or e-cigarette use is just absolutely not an effective cessation strategy, especially for youth. It's not even evidence-based for adults. And so, in fact, youth who switch are actually less likely than to successfully quit cigarettes. And one of that reasons is when you're vaping, you're getting a lot more nicotine. And so then your addiction is stronger. And so what that tells all of us who work with youth, advocates, educators, any other public health professionals, is that we really need to inform youth that vaping can make it harder to quit. Vaping can make it harder to quit cigarettes if they go to those, and they're more likely to then become addicted to cigarettes too. So again, you ask yourself, well, why should we be concerned? Another reason is because the nicotine, these are youth. Well, most people start using nicotine when they're a youth. And you may have heard that statement, brains are not born, they're built, right? It's what we expose ourselves to that influence our behaviors and our brains. And so when young people use substances at an early age, which often they're starting nicotine at an early age, they're training their brains to need and then to desire that substance to feel normal. And then over time, that substance changes the brain, right? It changes the brain in ways that it makes it hard to lay down memories. It makes it affects their mood, and then it influences their behavior too. And so all of that makes it harder to stop. And so then it's changing the brain, and it's even setting people up for addiction to other substances later in life.
Right.
So, so those are just a few of the reasons why it's so
Right.
important that we deal with this.
Right. Right. And when I was, when I first started, and I was thinking about young people, and I was thinking about how when you look at some of that youth risk behavior survey data, you've seen cigarette smoking go down for youth, right? And I imagine in public health, we were like, yes, right? Like, yay, we've been doing it, And then starting 4 or 5, or I guess, I don't know when the first time we asked about vaping, but now it's up to 50, 70%. At least tried. And so it's like there was this battle that was, from a public health perspective, really not one entirely, but really a huge impact made on that battle with youth cigarette smoking. And now we have this new product that has really taken, had a big impact on our young people.
And it has been marketed as a device that is safer than smoking. And is it safer than smoking? Yes. But is it safe? No. Right? We know it's a vapor, so it contains, it's not just water, right? It's not a mist. It actually contains chemicals that are harmful to people. They're harmful. And they're heavy metals. Some of the chemicals that are in there are heavy metals. And so is it a safer alternative than smoking? Yes, probably, but it's not a safe thing to do. And so we really need to educate people about that. And there are the Tobacco Prevention and Control and other partners that are part of our ecosystem of public health are working to do that. We've got Breathe NH. They go into schools and they do assemblies and they address health classes and they talk about science of addiction and they talk about the harmful effects of nicotine and all the other things that are in vaping, and then try to give the kids some skills to be able to counter that.
What are some of the other prevention initiatives that you're working on?
So, well, as you know, Julie, like at the partnership, we're addressing that, right? And we really try to take that approach of creating that narrative of solutions, and we'll talk about the problem, but we want people to know there are things that you can do. You and I, everybody, everyday things that we can do. So we want to inform about the negative consequences, but we also want you to feel like when you go to the partnership, you can find resources. And so I know our listeners out there hear this all the time, right? But I don't think it can be overemphasized. Absolutely. That you make a difference when you show that you take an interest in the lives of young people. And so when you let them know that you care and that you're concerned about what's going on in their life, that is such a protective factor for them, right? That they know that an adult has their back. So talking to youth about vaping, finding out what's going on in their environment when they go to school, what do they see, what do they hear, and what do they do? What do their peers do? Finding out about that and arming yourself with the facts so you can talk about what, the facts about vaping. But caring, connection, and concern are really the most powerful tools that we have in public health, and they're free, right? Yeah. So that's the good news. And if you're not quite sure how to start that conversation, I know you put in the chat the link to the partnership's resources on tobacco. And all of those resources have been translated into Spanish too. So you can go to that website. There's lots of different fact sheets. There's information that's going to tell you about vaping in New Hampshire, how it's affecting youth, and then what are some of those resources. And I'll talk about some of those too. But that's a really great place to start. So then another initiative that we're working on is in Nashua, and we're working with a prevention coalition, and it started out as a project to implement a public health intervention called SBIRT. And SBIRT stands for Screening, Brief Intervention, Referral to Treatment. It is something that is done when your child or even you go to your healthcare provider. You have your routine visit. They screen you on substance use, right? Mental health and substance use. And then based on your results, they talk to you about it. How is it going? Do you have any concerns? And then if needed, they can make referrals and make connections to support in the community if you need more. So we were wanting to do that within the school. We ran into all kinds of factors that really prevented us from being able to do that intervention. But what it did lead to is establishing connections with guidance and others in the school and giving us a place to begin to build on those relationships and to look at and bring more attention to how these particular schools are responding to the mental health and wellness needs of the youth in those schools. And so that's where we're at now, working with the coalition, supporting them to establish leadership groups so that they're building the capacity with some of the youth and the advisors, and looking at that whole continuum of professionals and people that are in that school that can, show kids they care and provide resources and increase that connection that youth have to their schools. And so the underpinning of that is really that caring and that connection again, and taking an interest in the youth. And so it starts with, where can we have these conversations, and giving staff and people the skills and the resources to have them. And then if the negative behavior or the destructive or risky behavior continues, incrementally turning it up and bringing in more resources, but ultimately trying to prevent a really negative situation.
Right. That just reminds me of this conversation I had, and I think it was in a training, on vaping actually. And one of the participants asked, like, what can I do if I suspect that, this young person is vaping? And I think that this individual was a school staff member. They had just learned about some of the symptoms and, the mood changes and what withdrawal looks like, so they were like, I think one of my students is vaping. They have to leave the classroom a lot. What do I do if I suspect? And I was like, ask them. Ask them if they're
start
okay.
there.
Right?
Yeah.
Ask them if they're okay. Let them know that you see them. Like, not in I see you. I see you're leaving my room every day. But hey, I noticed that you have to leave class every day. A lot of times that's a sign of feeling uncomfortable or nervous or, having some, discomfort being in class. Like, how are you doing? Right? Expressing that care.
Yeah.
And this was a very good, but it was like, oh, right. Because sometimes we approach these topics like alcohol use or tobacco use in a very, like, this is bad. I need to figure out how to get them to stop and punish them, right? As a parent, we do that, in a school area, of course, like, it's against the rules. But what we I think all need to do is step back a little and remember that these are symptoms, right, of something else that's going on, right? And be able to just ask that question and show that you care. I notice that you're acting a little different, you're not as engaged as you were. Is everything okay?
And that approach builds rapport. It builds trust. It might not happen right away, but
it might not. Yeah.
If you're going to help someone, you got to understand where they're coming from. And that actually kind of leads into some other things that we're doing. And, we always try to take that approach, nothing about us without us, right? In public health, we talk about that. And so we recently have talked to more than 50 young people and 50 adults, because we're getting ready to reboot and refresh a couple of campaigns that we have. And one is for adult cessation, right? And then the other is for youth cessation and prevention. And all of these resources are in the chat, but that campaign is called Save Your Breath. And so we wanted to go out and talk to youth about what they know about vaping, what they feel about it, what is going on every day for them. And one of the things that they told us is, well, when they go from middle school to high school, it really explodes. It becomes a really big problem. And they did get a lot of those prevention messages from their health class in middle school. So they kind of know the basics. They don't know everything, but then when they go to high school, there's a lot of pressure. It's being used a lot. It's around them. It's offered. There's pressure. They might start to feel more anxious at that time during that transition. They may then vape to just fit in. They also, a large number of the kids told us they're getting it from adults in their life or older siblings. And then the other thing that stood out is they often, by the time they get in trouble, let's say, or they get caught vaping, they're already addicted. So it's not like we can just say to them, you need to stop, because they don't know how. It doesn't feel good when they try, they're uncomfortable. So they really need they need us, the adults, to understand that this is challenging for them and that it's going to take some time for them to be able to quit or cut back. And so to give them those resources to do that. And I really think that's what schools are looking for now. You hear about it all the time for your work with SAPs, is school personnel and the other organizations that are serving youth. They want to know what is it that we can do that is supportive, because we know just telling people to stop, right? It doesn't work. Hello, it doesn't work with adults, and it doesn't work with youth, right?
Right.
So what is it that we can, what sort of response can we build that can be more supportive? And so the Tobacco Prevention and Control Program funds the prevention campaign called Save Your Breath, targeted at youth, really focused on youth, gives them a lot of great information. And then they also have a cessation program for youth. And youth can access it in a couple of different ways: texting, calling. And that is called Save My Breath. Oh, no, I'm sorry. It's called My Life. It's called My Life, My Quit. And it's free. They get a coach they can work with one-on-one. And they can really, it's run by National Jewish Health. Both the adult and the youth quit lines are run by National Jewish Health, and they're really the experts in that field of treatment for people.
Is that anonymous? Like a young person can just do that, right? They don't need to have adults' permission, or they don't need to. Is it anonymous? Do they share their name or?
No, it's private and confidential. It's not shared with their parents. It's not shared with anybody.
Yeah, it's just on their phone.
So they can.
It can be a text line, or it can be one thing that just two things, and then we should probably wrap it up, because we try to keep these on the manageable side for people to watch and listen to. But one thing, when you were saying some of your takeaways, I was honored to be able to attend one of these focus listening sessions with a group of young people, and the whole group concurred that, and this really hits home and resonates for me, is that parents need to know more, and parents need to have these conversations with them, because again, by the time parents talk to them, they've been caught. It's a punishment. So it's not an earlier conversation. It's not asking them, like you said, asking, what do you know? What are you learning? How do you feel about this? How often are you seeing it? And so it really, the whole group, there was a group consensus about this, which I thought was
good point.
Wonderful as a parent. And we say that all the time. You may not think so, but you
make a difference.
You make a difference. And then I think the other thing, just around that confidentiality piece with some of these resources, it's really important to our young people and their phones. They're pretty aware that privacy stuff with phones that, and I even learned this about but so that's great to know. And I think if you are guiding a young person to do My Life, My Quit, or letting them know about it, that you should really be able to that it's confidential. Sorry.
Yeah, right.
Because we actually have a comment, and the listener does have to leave, but maybe we could follow up in this and just around that secondhand vaping and the impact on the same breathing area. How vaping in front of children has a negative influence on them, and the likelihood of, so the impact of that modeling. And we do know that modeling makes a huge difference, right? I share this story all the time about the first time I smoked a cigarette, right? Like I hope my mom's not listening, but she would come home from work and she was, it was a hard day, and smoked a cigarette. And I remember when I was younger, I had my first stressful day, and I got home and one of the neighborhood kids offered me a cigarette. And I, for the first time, I had said no for 4 years. I said, no, they're gross. And then I said yes.
Yeah.
Right. So our modeling is huge as adults and families. And I don't know if you know about the secondhand vapor and the impact of being around vapes for young people. That was the other question. Do you know
I don't have any information to give you on that. Sorry. And I don't want to misspeak about, the impact of the secondhand smoke. Clearly there's secondhand smoke from cigarettes is very harmful. So.
And I also don't have anything other than having heard, right, that it is, and I've seen some of the vapor residue on the inside of cars. So it is sticking to the inside of a car, which probably means it's sticking to the inside of other things. But again, I'm just speaking at that part. Okay. So it is time, Martha. Thank you so much for sharing some of these. And I know that there's more going on, and you can visit the partnership at Drug Free New Hampshire. And you can visit our, tobacco and vaping information. Also, the TPCP is in there. So there's a lot of information available and links on our website. And we hope that you will get engaged. If you have any questions, you can always reach out to the partnership at Drug Free New Hampshire, and we'll connect you with Martha. We'll connect you to the right resource. That's what this is for. So Janet, we can connect about that later, about the secondhand vaping. Today is the third day of Prevention Week here at the partnership. We have another Facebook Live tomorrow, same time, same place at 11:15, and we'll be talking with the Upper Valley all together about their initiative about talking, right? Talking matters, and the work that they've been doing to encourage those conversations with young people. And then Friday, we will be hosting our video launch for Better Now, Life Without Substance Use. And we'll be having a panel discussion with 3 of the participants in that short film who will be sharing their experiences. And that will be on Zoom, and you can register at Partnership at Drug Free New Hampshire and get the Zoom link there. So we're very excited about the next 2 events as well. And you'll be able to see recordings of the other 2 events we've had this week, which is a prevention program showcase, all the New Hampshire-based prevention programs that have gone through the evidence-based process, as well as yesterday learning about student assistance program. So those resources will be available on the partnership website as well. Thank you all for being here. Thank you, Martha, so much. Enjoy the rest of this beautiful day, and we hope to see you all soon.
Bye, Julie.